Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, indications of liver transplantation. So, in the indications of liver transplantation, if we see all the most commons regarding indications of liver transplantation. So, these are the all most commons regarding indications of liver transplantation. So, most common indication of liver transplantation is cirrhosis from hepatitis C. Second most common indication of liver transplantation is alcoholic liver disease. Then we have most common indication of liver transplantation in children, it is biliary atresia. Most common metabolic disorder requiring liver transplantation is alpha 1 antitrypsin deficiency. Most common indication for liver transplantation following acute liver failure is acetaminophen toxicity. Sepsis and sepsis induced multiple organ failures. Sepsis and sepsis induced multiple organ failures are the most common cause of death in patients with liver transplantation.
thank you and thank you for watching.